Hi everyone. I am Arun Bilad, BSc fourth year agriculture student. I welcome you all to the series of lecture on livestock and poultry healthcare. So today we will learn about what is infection. So what are the causes of infection? What are the treatments infection? What is the mechanism of infection? So in infection there are four factors, that is ruminal acidosis, lactic acidosis, founder and CHO engagement. So ruminal acidosis means increase in the acid content. In the rumen there will be increase in the acid content. Lactic acidosis means there will be increase in the lactic acid. Founder means it is the inflammation of connective tissue in the hoop region. CHO engorgement means milk doesn't come from the breast during the infection. So infection, what is infection? Infection in dairy animals refers to the failure of digestion, slow passage and accumulation of feed in one or more of the stomach components leading to the constipation or absence of dung. So infection means there will be failure of digestion, slow passage. The passage will be not correct during infection, accumulation of feed in one or more part of the stomach. So in a cow in cow stomach there are four parts. So food will be accumulated in one or the more parts, leading to constipation and absence of dung. So there will constipation and absence of dung. During infection there is a deficiency of dung. So causes. What are the causes of infection? Feeds high in CHO or sugar with a lack of protein. When cattle feeds in a high carbohydrate content and sugar with a lack of protein, if there is a lack of protein in the diet or in the food of cattle, it causes infection. It is low quality forage, corn, high energy, prepared feeds, cereal grains, root crops. So forage, corn, cereal grains, these all are the foods which are high in carbohydrate content. So eating plastic and other foreign debris. If the cow eats plastic and other foreign debris, it will cause infection. Lack of water, hungry animals gorging on the forage. If hungry animals, if they feed on the forage, if they graze on the forage, it will also cause infection. Hair balls in fiber goats, high amount of non-PTN nitrogenous compounds. PTN means pleiotrope nitrogen compounds. So if the diet which is lacking in protein or nitrogen content, so it will cause infection. Unripened green food, if the cow eats unripened green food, it will also cause infection. So these are the 7 main causes of infection. So now understand this, what infection, there are two types of infection. One is primary infection, one is secondary infection. What is primary infection? Primary infection, it refers to the accumulation of poor quality roughages in any one of the four stomach compartments. So as earlier I said, so in a cow in cow stomach there are four parts, that is abomasum, abomasum, rumen. So okay, so there is a accumulation of roughage in the stomach compartments. So it is a relatively rare condition and involves nearly in all animals. So this primary infection is very rare. So secondary infection, any inflammation of gut or associated gut motility lead to the secondary infection. So it is the infection of gut. So that causes a secondary infection. So there will be not accumulation of food in the stomach and passage the food going through the food pipe, intestine, it will be very problem in the cattle during infection. So that is secondary infection, that is inflammation of gut is secondary infection. So next one is pathogenesis. What is pathogenesis? Means how pathogens cause infection. That is called pathogenesis. So eating high fermentable CHO food. High fermentable CHO food means high carbohydrate containing fermentable food. So that fermentable means the carbohydrates are usually fermented by yeast and other fungi. So that if cattle eats that feed, so it will cause infection. Disturbance in a normal microflora and protozoa. So in infection there will be high accumulation of lactic acid and acidosis. So CHO means, so to digest the CHO, we will require some bacteria. So some gram positive lactic acid bacilli and gram negative celluloid. So it will be disturbance during infection. So the activity of microorganisms will be disturbed. Microflora and protozoa. Okay, lead to increased lactic acid bacteria and decrease of cellulotic bacteria. So cellulotic bacteria, lactic acid bacteria, two bacteria which help they are present in the stomach. Lactic acid bacteria means increases lactic acid. Lactic acidosis, increase in the lactic acid. So decrease in cellulotic bacteria. Cellulotic bacteria means which helps in the digestion of carbohydrates. That will be decreased. Next point, increased lactic acid microflora leads to the increase in lactic acid in the rumen. So lactic acid will be increased in the rumen. So flora of the lactic acid bacteria will increase and cellulotic bacteria will decrease. Lactic acid is more absorbable than VFA. So VFA means volatile fatty acids. So that are required, but during infection, lactic acid is more absorbed than VFA. That is volatile fatty acids. Next, so it passes to blood leads to decrease in the milk production. So during infection, there will be decrease in the milk production. Sometimes milk production stops. So high lactic acid in the rumen. So the main cause of infection is here lactic acid plays a very important role. So decrease in the pH. So decrease in pH means increase in acid contents. Acidosis means increase in acid, killing of ruminal microflora. Okay, the bacteria are fungi which help in the digestion of carbohydrates that will be decreased during the infection. So increase in osmotic pressure in a rumen fluid go to distended abdomen. So distended abdomen means there will be pressure from the inside the stomach. That is called distended abdomen. Acidemia means increase in acidic content due to acidemia due to draw of fluid and alkaline radical from blood to the rumen. So there will be increase in acidic content, acidemia, hemoconcentration and dehydration. So infection causes dehydration and hemoconcentration. So that is increase in the blood level. So low milk production because of lactic acid is more strong than VFA. So during infection there will be low milk production. Why there is low milk production? Because lactic acid is more strong than VFA. So VFA will decrease. That is volatile fatty acids required for the metabolism of milk, production of milk, that will be decreased during the infection. So lameness due to the production of EMS. Lameness means the cow will become dull. Upset go to the limbs and joints. So next one is what are the symptoms? So what are the symptoms observed during the infection? Infection of food, no rumen sounds, lameness. No rumen sounds. If we check the sounds of rumen using stethoscope, there will be no rumen sounds. Lameness means it cow will become totally dull. So next one is respiratory distress, low milk. Milk will be low. Sometimes it causes sudden death. Respiratory distress means the cow have the breathing problem. It have respiratory problems during infection. So abdominal distension and constipation. As earlier I said, distension means there will be pressure from inside the stomach. So constipation means so the passage of ball and feces. The feces will not be correctly excreted out during infection. The cow will get problem during the excretion, during the egestion of the feces. So next one is, so what are the symptoms? The cow will become lazy and recombinant. Lazy means the cow will become lazy, dull, and recumbent means the cow will lie down, grinding teeth in pain. The crow will grind like pig. Lack of feces means feces, there will be no feces because there will be constipation, there will be no correct digestion. So there will be lack of feces. Abnormal heart sound and rate. So heart sound will be abnormal and there is no rumen sounds only. Signs of dehydration. So the cow will suffer from dehydration, dullness. The cow will become totally dull. So now what is the treatment? What are the measures to overcome the infection? Okay, treatment. So there are main 9 points to prevent or to treat the infection. So evacuation of ruminal content. So we have to evacuate. We have to evacuate the ruminal content by stomach tube. There is an instrument called a stomach tube which helps in the evacuation of ruminal content. NaHCO3. So NaHCO3 means NaHCO4, sodium bicarbonate. So bicarbonate is alkaline agent. So if there is an increase in lactic acid, so to overcome the effect, to encounter the effect of lactic acid, so we have to administer the NaHCO3, that is sodium bicarbonate. Oral NaHCO3, so NaHCO3 means sodium bicarbonate can be administered orally, or Mg hydroxide means magnesium hydroxide, or Mg peroxide. Ruminal juice transplantation. So means there is a technology called ruminal juice transplantation. So which help to overcome which is the best method of treatment of infection. So stomachic. So there will be there will be pain in the stomach. Antihistamic to avoid lameness. So antihistamic medicines we have to administer. We have to inject to avoid lameness. So treatment of dehydration. So we have to treat the dehydration. Vitamin B complex for metabolism of lactic acid. So friends, I'm telling you, lactic acid is the main player which cause the infection. So metabolism, we have to decrease the concentration of lactic acid. So that is the main role of that is decreasing metabolizing lactic acid. So vitamin B complex should be administered so to metabolize the lactic acid. So we have to decrease the lactic acid. So corticosteroids for treatment of shock. So corticosteroid, there is steroids called corticosteroids that should be given for the treatment of shock. Now it is prevention. So how to prevent the infection? Okay, what are the preventive measures? So as we tell, the prevention is better than cure. So before getting any disease, why can't we prevent before coming it only? So after coming treating, that is a very long process. So we have to any disease before coming, we have to prevent. Okay, prevention is better than cure. So now let us see what are the prevention measures to avoid the infection. So if your forage is not high quality, make sure animals are receiving a protein supplements. So if your forage is not a high quality, so if your forage is not high quality, make sure animals are receiving a protein supplement. So forage, more forage should be avoided to the cattle because it contains cellulose. Okay, cellulose is a rich carbohydrate content. So that is the main problem. So protein supplement, we have to give the protein supplements, protein blocks, that are the good prevention. So don't allow hungry animals to gorge on the forage. So we have not to allow the hungry animals to gorge on the forage. Check to make sure animals have constant water supply. So water supply should be constant. So during infection, because to prevent dehydration. So keep your pens, esters clean and free of debris, especially plastic. So surrounding environments should be free from the debris and plastic. So avoid misdistribution, miscalculation, mixing. So because during infection we have to feed correct. We have to feed correct formulations what veterinarians suggest. So thank you everyone for listening my series of lecture on livestock and poultry healthcare. So I thank everyone. I thank everyone for my infection topic.